Hi, my name is Elisa Gindi, and I am presenting my county profile paper on the county Contra Costa. Contra Costa was established in 1850, and it is a county in Northern California, and it's considered the East Bay community. It is one of the original 27 counties in California and includes 19 different cities, but the three most popular and most populous cities are Concord, Antioch, and Richmond. It is also home to Mount Diablo, which is a beautiful mountain with a bunch of hillsides. The estimated population of Contra Costa County as of January 1st, 2020 was 1,153,561 compared to a lower population in 2019. This inferred that the population was on a rise by 0.3%. Even though it's a little amount, it's still on a rise within just 1 year. As we know, many factors go into the overall health of an individual and the community or county that they live in. Different factors can include racial demographics, age, and gender. And the demographic of this population is very diverse by race. 43.2% are white, 25.8% is Hispanic or Latino, 18% is Asian, 9.5% are Black or African American people, and 5.3% people are classified as two or more races, and 0.6% of the people are Native Hawaiian or Pacific Islander. As for age, 5.6% of the population is under 5, 22.6% is under 18, and 15.8% are 65 and older. And in regards to gender, females slightly dominate this population at 51.1%, while men are the other 48.9% of the county's population. Along with demographics and age, socioeconomic status plays a crucial role in an individual's well-being and is considered a social determinant of health. Factors that are often measured when we look at socioeconomic status of a population are income, education, and occupation. Contra Costa County has approximately 392,277 households with a median income of $93,712. This income is significantly higher than the median household income of California, being at $71,000. And 35.1% of families and people per household speak a language other than English. The percentage of people living in poverty is only 7.8%, which is actually lower compared to the 12.8% of individuals throughout California, and the total percent of labor force populations older than 16 is 64.6%, and of these people, 58.6% of them are female, and only 3.2% of the population is unemployed. As for education, 88% of individuals graduated from high school and 71% attended some level of college. Unfortunately, environmental factors are not as pleasing to see or read about. 21% of the population lives in severe housing conditions, and the air pollution particle matter is at 11.6 micrograms per cubic meter. However, the air pollution level is getting significantly better, and the majority of these statistics are better than the average percentages of California as a whole. As we've learned through the course, having access to healthcare is crucial to improving the health of individuals within any population, and without access to healthcare, a barrier is formed between the uninsured and healthy living. So as for Contra Costa County, the uninsured rate for individuals under 65 years old is 7%, while the overall average in California is actually 10%. So it's a little better than California's average. In 2017, 96.5% of children and youth from birth to ages 18 are insured. 70.5% of these children are insured through either private coverage, and then 29.9% are insured through public coverage. And actually only 3% of children from ages 0 to 18 in the county are uninsured. 5.9% of Contra Costa's population under 65 years old are uninsured, compared to the 8.3% of all of California. So overall, Contra Costa has a better insured rate compared to the average of California. Providing coverage and establishing a medical health plan is a great step toward ensuring quality and healthy living. Contra Costa actually takes pride in knowing that they are the first country-sponsored health plan in California to offer Medi-Cal coverage. And following the implementation of the Affordable Care Act, Contra Costa enrolled over 35,000 individuals into Medi-Cal managed care and over 25,000 individuals into the Contra Costa medical care managed care. Contra Costa follows a two-plan model that offers two different plans for those who qualify for Medi-Cal at no cost. And aside from the Medi-Cal managed care, Contra Costa actually offers coverage to full-time county employees and medical and dental coverage for home care providers. In addition to the importance of healthcare coverage and access to healthcare, it's just as important for communities and counties to have enough hospitals and physicians to treat those with the coverage. Contra Costa County has two different provider networks to choose from. The first one is through the Regional Medical Center Network, which has 10 different health centers located throughout the county. And the other option is the Community Provider Network, which is a network of community-based private providers. In addition, Contra Costa has primary care physician ratio of 970 to 1. So every 970 people, there's one physician. But the number of physicians in the past 10 years has unfortunately decreased. Maintaining good health should not be limited to the lives of adults or elderly, but should also include child health and should be considered when looking at the general health of a population. There are multiple articles and evidence to support the fact that having good health during childhood sets the tone for adulthood and creates a foundation for lifelong health. 72.9% of children in Contra Costa County reported being in excellent or very good health, and 27.1% were reported as good health. Also, 96.4% of kindergartners reported having all required immunizations, which is a crucial factor in child health and the control of spreading sickness. Both mental health and physical health are closely related and play an important role in a person's ability to live a long and healthy life, and having access to mental health services and programs can prevent physical health from deteriorating and improve one's quality of life. Fortunately, Contra Costa County offers a large variety of public health and mental health services and programs. They have the Crisis Center, where call specialists can refer callers to different mental health services and talk with health professionals or trained professionals and other certified people. There's also the Contra Costa Mental Health, and that's a network of mental health services and resources that provide recovery opportunities and programs for people throughout the county. Contra Costa Health Services is actually the largest department of county government that provides high-quality services and integrates healthcare services to protect and care for the health of their patients. Aside from behavioral and mental health services, the county has resettlement agencies as well, which include international rescue committees, which is dedicated to providing opportunities for refugees. They're in affiliation with the Food Bank of Contra Costa, which distributes food items to low-income communities and nonprofit organizations that serve the ill. And it's also in association with the CalFresh program, which helps meet nutritional needs of those who are less fortunate and is dedicated to providing public services in hopes of improving the quality of life of the entire county. On top of everything we've already covered and discussed, nutrition and food insecurity impacts the health of a population. Food insecurity falls under the economic stability social determinant of health and is not just limited to a lack of food, but also the lack of nutritional value consumed. So the number of individuals in Contra Costa County who were affected by food insecurity is 97,000, or 41% of the population. That's pretty alarming to me, and that ultimately affects individuals from all demographic backgrounds. It was also included that the minimum living wage necessary for a family's basic needs in the county is $85,000. So you could only imagine what other disparities they come across, considering how much it is just for basic family needs like food, water, living, nothing extra. One of the most alarming health issues that I came across in the Contra Costa County was the obesity rate among adults. According to a 2010 Community Health Indicator report, more than half of Contra Costa's adults were either overweight or obese. This data obviously isn't anywhere near alarming considering California's rate and the nation's rate of obesity, but it's still significant, and obesity causes multiple negative health outcomes and affects your physical and your mental health. Possible solutions to this health problem is the implementation of programs in schools or a workplace to educate people on the importance of healthy eating habits, regular exercise, and the impact negative health choices have over our lives and our overall health. A recommendation to changing or preventing this health disparity or obesity is providing classes and programs to teach parents on the importance of healthy eating habits or healthy habits in general, so that way they can share the information and apply their learnings with their families. A more accessible or doable recommendation would be taking daily walks, staying active, and becoming aware of the difference between what you want and what your body actually needs, and not confusing the two.